morning and welcome to the Senior Hour, which is sponsored by Comfort Keepers in Home Care and Advanced Audiology. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on KHTS, your hometown station. This is a show for, about, and by seniors, giving information to enhance one's quality of life. And our first guest this morning is Mike Dougherty, and he is the Community Relations Representative for the Behavioral Health Unit at Henry Mayo Newhall Hospital. Wow, what a mouthful.
Yes, that is. Hello. It took up half the show just to introduce me, right?
It's good to have you back again.
It's great to be here.
Good.
How are you enjoying summer?
Oh, do you like this hot weather?
A little hot.
A tad warm, yes. That's what we have. Just one of the things we have to suffer through to be here in Santa Clarita.
But I think we're having extremely hot weather earlier than we normally do.
I would agree with that.
I don't remember June being this hot for so many days consecutively. You know, it's usually June gloom.
Yeah.
That's right.
And what, hazy May?
You know, we might not be close enough to the beach.
Oh.
You know, because you get those coastal clouds, you know, we're 1,200 feet up.
I was at the beach yesterday.
Wow.
Went to Malibu to visit Dr. Barbecue.
How did that go?
The visit was very nice. Very nice. And he's not doing well at all, which is such a shame.
Well, when you see him, give him our best wishes from this community.
Oh, we do.
He served us very well.
Oh, yeah, we do. We do every time. Cheryl Gray and I go, usually about once a month or once every 3 weeks on a Tuesday, and take them lunch. Mm-hmm. And Risa, his wife, had a heart attack.
Yikes.
Yeah. And
That makes it tough.
Oh, yeah. And she, because, you know, she's under a lot of stress taking care of him. But now they have 24-hour care, 7 days a week.
Wow.
And it's made it a lot easier for her. So, but anyway, what are we talking about today, Mike?
Well, today I thought I'd talk a little bit about some facts about mental health and aging.
Mm-hmm. Mm-hmm. Yep.
Us old people.
Something we face every day.
We do. And the younger folks that are listening are they age every single day, don't they?
Yes, they do.
They're another day older.
But doesn't it
As the
seem
song
like
used to say, and deeper in debt. Right?
I know, there you go. I'm not getting any older. I refuse to.
Good. You're going the other way? Are
Yes,
you?
I am.
That's good. I've heard of that. I don't know how you do it, but that works well.
I'll let you know in a little while.
Well, what I wanted to say to kind of start things off is as many as 1 in 5 older adults experience mental health concerns that are not a normal part of aging. And the most common of those are anxiety or mood disorders, including depression. And undiagnosed and untreated mental health illness can be very serious for older adults and their loved ones as well. And we've talked about this before on the show, but you know, there's that thing out there that for some reason older adults, seniors in particular, think, most of them, by the way, about 65% or better, think that depression is a normal part of getting older. And it absolutely isn't. It's an illness, and it needs to be treated any time it's found.
Mm-hmm.
Interesting. Yeah, because I know when I lost my son 31 years ago, I went into a deep depression. I mean, it losing a part of you really just sends you into a tailspin. And it did for me. And thank goodness I have 2 other children, you know. Mm-hmm. And they helped, and Russ helped. But it was unbelievable. And I didn't realize I was under so much stress and depressed.
And you just mentioned this, but another fact is that mental health is as important, I should say, as physical health.
Yeah, oh yes.
Good mental health contributes greatly to an overall feeling of well-being. And untreated mental health disorders in older adults can lead to diminished functioning, substance abuse, poor quality of life, and increased mortality. And research shows mental illness can slow healing from physical illnesses. And Dr. Dorio knows all this. I mean, you see people who have had a stroke, they get depressed, their recovery takes a lot longer, and therefore costs them a lot more money. So this is something they need to be aware of. And I was mentioning this to Barbara a moment ago, but Wednesday, July 12th at 1 o'clock, I'm going to be at the SCV Senior Center, and the topic is going to be how seniors can enjoy great mental health. And we're going to talk about the fact that mental health and physical health go hand in hand.
There's no doubt about that. And I think in the past, it really does. It not only applies to our seniors, but, from the rocky roads of being in kindergarten all the way out, it's a problem. But, unfortunately, in my profession, the mental side of health has not been through our professional communities has not been contributing to our physical health, and indeed it does. And it's taken a long time, I think, for people to really see that there is a cause and effect. And when because some doctors are trained in that way, they're not recognizing that, something at home, a financial situation, a marital situation, a situation with either siblings or with your children can cause problems and then result in physical problems. That has not been out there for a real long time. I mean, people have talked about it, but the literature always says, well, let's get some evidence-based studies that show that this is connected. But my medical profession has been very slow at bringing this process forward and making the public aware how mental health then affects you physically.
Right, and of course that, as you know, Dr. Dorio, is one of the things that doctors need to say to their patients. Well, what's going on here? Let's talk about it. How are things at home? What's going on here?
But when you have now, as we all talk about on this show, 5 to 10 to, at the most 15 minutes to talk to your doctor on an office call.
That's right.
I mean, for some of my patients, they've barely, in 5 minutes taken off their sweater. It just takes a long time, and you have to be able to give your patients that time. And in my mind, that is not what's happening now in medicine. And, I think that doctors have prided themselves on having in this country the best technology to provide care. But yet, are we becoming just a little bit too reliant on that and giving medications, giving drugs, and doing a test and saying, hello, how are you? Oh, you have a headache? Let's get an MRI. Like that. And I think it's unfortunate that, getting to the crux of problems has been lost. Medicine is an art, and that is being lost for our patients. And time and being able to talk to your doctor about issues related that are up and coming in your life and affecting you, that's not happening anymore.
Well, I agree with you, but I have to say, I'm not going to mention them by name, but my doctors have been marvelous in that area. They really have. I feel really blessed. They'll sit down, they'll listen to me, they'll talk, and my input is important to them. And it's a great relationship, and it's too bad that more people don't have that kind of relationship, like you said.
Yeah, it's not so much, it's a relationship, and it's, it counts on the doctor who, is attempting to give their patients care, but too often now they are dictated by other forces, financial forces, that won't allow them to spend that time. And, I don't think doctors like that at all, because they know that to get appropriate history is going to guide them in what they're going to do afterwards in terms of testing for their patient.
And it's so, we've talked about this on this show as well, but this is so very important for your listener. I'm talking directly to you. You're listening right now. I'm talking to you. You need to know this. And that is that if you don't take care of your mental health, just like you take care of your physical health, you're in serious jeopardy. And here's why. Suicide is a risk among older adults.
Yes, that's right.
And when I ask this question, I know that Barbara, you and Dr. Dorio know the answer to this, but I'm going to ask this for your listeners so they can turn up that radio right now. I'm going to ask you a question. I bet you don't know the answer to this. What is the age group that has the highest rate of completed suicides out of any other age group? Now, most people go right to college-age student. Lots of stress there. College has to.
Absolutely.
That's actually not correct. Those aged 85 and over have the highest suicide rate, and those aged 75 to 84 have the second highest. And get this, when seniors try to commit suicide, they are more successful at it than anyone else. You know that sometimes people out there will have 20 suicide attempts, and of course a lot of that may be just cries for help. But when it comes to seniors, 1 out of every 4 attempts is successful. So this is serious stuff. You need to be mentally healthy.
Yes, you do.
Yeah.
Yes,
Isn't
you
that a
do.
wake-up call when you hear that? Can you imagine?
It's staggering that these statistics are out there. They're local, they're state, they're national, but yet, we're not doing anything about that. I don't think. I think that mental health and treatment for mental health issues in this country across the board for all age groups is lacking. And it did start many years ago in California when we shut down Camarillo Metropolitan State Hospital. We still have a Atascadero. But, I used to visit those hospitals as a teen with my father, who would go there, not as a patient, nor I, but because he was treating people there. And I got to sit amongst the people with mental illness as he was helping his clients to evolve and get out of those institutes. But to me, they were invaluable in terms of moving people forward and reacclimating them to the community. We don't have any of that anymore, and the only place they get it is on the street, they become homeless. So about a third of our homeless population have mental illness.
Yes.
And for us as a society to accept that is inappropriate. I mean, we need to focus greatly on assuring that mental illness at whatever level is treated and is looked at and is cared for by professionals who can handle it. I think that as depression is an illness, across the board, mental health is an illness. And physiologically, I think we will find that the brain and the neurotransmitters and the hormone system, they all play a role in that balance that they're out of. And because they are, I think that we could in some way learn how to correct it. But we're not doing that right now.
That's true. You mentioned the closure of those facilities and how profound that was, but I can really put a spotlight on that even farther, because that was some years ago, but we are feeling the fallout from that today very seriously,
right.
even in the behavioral health unit here at Henry Mayo Newhall Hospital, where I work. And here's why. When we have people who need to go to what they call an IMD, that's an Institute for Mental Disease, a bit of an unfortunate name, but when they have to live in a locked facility, there are very few places available. So here's what happens. They go on a waiting list. We have had people in our unit waiting for up to 6 to 8 months, waiting for a bed to open. Now, let me tell you, our behavioral health unit is a short-term facility. The average length of stay is 5 days. There are certainly people that are there a lot longer than that, but 6 to 8 months is way out of the norm. And the only reason a person would be with us that long would be waiting for a bed in one of these facilities that, as Dr. Dorio pointed out, have closed.
Closed down.
And here's what happens. If somebody that's in one of those facilities is put into what they call a step down, in other words, they're doing better, so they put them in a step down facility where they have a little bit more freedom, but they're still watched. If they don't do well and have to go back into the locked facility, then everybody on the waiting list gets pushed down.
Mm-hmm.
Do you ever have to refer them out of our area, say to the San Fernando Valley? Or
Oh, sure. Yeah, there are no
Antelope Valley.
IMDs or Institutes for Mental Disease here in Santa Clarita. They definitely have to go someplace else, which is a
And
bit
those
sad.
beds are usually full as well.
Yes, absolutely.
Yes.
Yeah,
Yeah.
they're including, one of the places would be Atascadero, but that's I believe that's more criminally involved. If I'm not
You know,
mistaken.
I think they've pretty much had to change how
Change
that
that,
was
yeah.
because, what I saw at all three places were about the same level of patients that were there. But that could have changed. And I, out of UCLA, I was at Olive View, and Olive View had a closed facility. And
Yeah.
I will tell you, one of my best learning experiences was to be in a closed facility taking care of patients. But those are few and far between nowadays, and there's recognition of mental health problems in our society, especially by physicians, sometimes by family members, but government doesn't recognize that, unfortunately, and they're not willing to pay the bill for that. And I will tell you, there are many, many people who have mental illness. When they are in a balance, they are able to cope in society. They are able to go back to work. They are able to then pay taxes and be productive. So they're reclaimable. We can get them back. We worry about the recycling of plastics and things like that. We have to recycle people. We have to get them back to where they can be taking care of themselves.
And
That's
that's the
right.
good news, because through medication, if it's necessary, and it isn't always necessary, and psychotherapy, which is basically seeing a therapist or a psychiatrist, most people can get back to their regular lives.
And that is so important. It really is. It's so very, very important. And we were talking about exercise relating to mental health.
Oh,
It-
yeah.
it's incredible. And the gym I go to, there are so many older people there, men and women, just bicycling away or lifting weights and that kind of thing. And it's really refreshing to see.
Well, and here it is.
It is.
Healthy older adults can continue to thrive, grow, and enjoy life. Reading, walking, socializing are just a few of the activities that many individuals enjoy at any age. But when you exercise your mind and your body and maintain social connections, it's good for your mental health and your physical health.
Absolutely.
It's preventative. And that's the most important thing, which we all have to do, because, no one knows what is going to happen to us. Nobody knows what's going to push us over the edge. Nobody knows that. But I think there are lots of people who are listening now and maybe here in the studio who, easily we can go over that edge. And, I think, so many of our listeners are can do well in our community. We do well in our community. Why aren't we helping those who are not doing well to get them back on their feet? We have to do that.
That's
Yes,
true.
we do.
And I'm glad this discussion is taking place so our listeners become aware this is a disease. It's not something that we can ignore, and we can do better. So
And the good news is we can take care of it. You don't have to
That's
sit there
right.
and suffer. In fact, if you sit there and suffer, you're being silly, because you can feel better.
Well, also it's incumbent upon caregivers, loved ones, children, husbands, if they see someone just, oh, I don't want to shower, oh, I don't want to get up, I don't want to go out, that's a sign of depression.
They need to be able to connect the dots.
That's right.
Yep.
That's absolutely right. And hopefully most of us will be doing that.
Yep.
Taking care of ourselves and taking care of our loved ones and our friends and relatives.
Great, Barbara.
And Mike, it was great having you here.
It's wonderful.
always
What
is.
an incredible subject.
July 19th, they told me I'm coming back. So
Yes,
if
July
I didn't blow it
19th.
today, they were going to allow me to come back.
And you'll be at the Senior Center on the
Oh, that's coming up
That's on
on
the 12th?
Wednesday, July 12th. And then Thursday, July 27th at 11 o'clock, I'm speaking, same thing, how seniors can enjoy great mental health. And I'm going to do that at Canterbury Village here in
Yes.
Santa Clarita. So
Terrific.
great folks over there.
Terrific.
Very
Thank you, Mike. We'll see you on July 19th.
You got it.
If not before. Terrific. Thanks again. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, KHTS.